Thank you, Mr. Chairman. It is my honor, tinged with not a small amount of bittersweetness, to read this resolution honoring Dr. Penny Borenstein, who I don't see. There she is. There she is, trying to remain behind the scenes, but unsuccessful. The resolution reads as follows. Whereas, upon retirement, we celebrate 17 years of commendable service that Dr. Penny E. Borenstein has provided the County of San Luis Obispo's Public Health Department since September 1st, 2008. And whereas for nearly 2 decades, Dr. Borenstein has faithfully served the people of San Luis Obispo County as County Health Officer and Public Health Administrator, providing steady, science-based leadership through work and unprecedented emergencies. And whereas throughout her career, Dr. Borenstein has kept a hand in clinical practice, including pediatrics, reproductive health, immunization clinics, and tuberculosis care, ensuring that her policy leadership remained grounded in personal connections to patient experience. And whereas Dr. Borenstein is known for maximizing every available resource, whether stretching a grant dollar or calculating vaccine doses, and could be found rapidly working at the whiteboard while colleagues looked on at her ability to quickly process complex information and make intricate mathematical calculations in real time. And whereas Dr. Borenstein led San Luis Obispo County through the H1N1 influenza pandemic, Ebola response planning, outbreaks of pertussis, meningitis, measles, and other diseases, and the COVID-19 pandemic, during which she provided steady, compassionate leadership. And whereas her response to COVID-19 included issuing public health guidance and orders, coordinating strategy, communicating consistently with calm, candor, and honesty through times of polarization and community-wide stress. And whereas Dr. Borenstein has been a passionate advocate of the public health laboratory, tactically applied its testing services in disease and outbreak response, and understood the nuances of high complexity test management. And whereas Dr. Borenstein has understood the importance of environmental health and came to be regarded as one of the most knowledgeable health officers in the state on the environmental topic of biosolids, providing continuous support appreciated by staff. And whereas she established the Health Promotion Division to address tobacco use, poor nutrition, and physical inactivity, which contribute to diseases responsible for more than half of all deaths, and recognize that improving health requires making healthier choices accessible. And whereas Dr. Borenstein has emphasized that while the county may outwardly appear idyllic, there remain significant struggles related to poverty, housing instability, and mental illness, and that we must be careful not to think there isn't work still to be done. And whereas Dr. Borenstein will retire effective July 4th, 2026, leaving a public health department strengthened by her leadership, a community safer and healthier because of her service, and a legacy that will shape the well-being of San Luis Obispo County for generations to come. Now, therefore, be it resolved and ordered that the Board of Supervisors of the County of San Luis Obispo, State of California, does hereby commend and thank Public Health Director Dr. Penny Borenstein, MD, MPH, for 17 years of dedication, extraordinary service, unwavering commitment to public health, and lasting contributions to the people of this county.
Thank you. Good morning, Chair and members of the board. It is my sincere pleasure to be here today to honor Dr. Borenstein. I'm Michelle Shoresman, Division Manager for Healthcare Access in County Public Health.
And I'm Elizabeth Merson, Planning, Evaluation, and Policy Division Manager for Public Health as well. Together, Michelle and I have the privilege of working with Dr. Borenstein for a combination of 32 years. Today, as she prepares to retire, it's our honor to thank her for her incredible service to our county and to comment on the resolution honoring her contributions.
Early in my career in public health, I had a supervisor that called us the best kept secret. And she meant that as a compliment. She meant that when public health is doing its thing and everybody is healthy and safe, no one knows we're here. Well, that all changed in 2019 with COVID. Now, as recently as last week, when I say what I do, or when people hear me say Dr. Borenstein's name, they often come up and say thank you for the work public health did as a whole, and Dr. Borenstein specifically did during the pandemic. They say that she brought calm and certainty and gained people's trust during that very difficult time. I can say, after working with her for so long, that the Dr. Borenstein that people saw in daily news conferences wasn't a show. That was the same person with the same calm, measured approach who gathered us around a conference table, stood at the whiteboard making calculations, spoke with patients in stressful situations, and fit in an important conversation while running across Johnson Avenue to get to the next meeting. The thing that many people don't see is that COVID-19 wasn't our only emergency response. Public health works behind the scenes to stop outbreaks before emergencies get to that level. Dr. Borenstein led us in responding to the H1N1 pandemic, wildfires, sewage spills, water contamination, measles, pertussis, meningitis, foodborne illness outbreaks, a variant of influenza that emerged here in our very own county, and so much more, all with her thoughtful approach and whiteboard marker in hand. Amid all that, she took calls from healthcare providers at all hours of the night, met with community groups early in the morning, and made time to attend every lunchtime baby shower for her staff.
And Dr. Borenstein did more than lead responses to emergencies and outbreaks. She also built the community's infrastructure to make health and well-being more accessible to people every day. She built the Health Promotion Division to increase access to nutrition, physical activity, and tobacco cessation. She recognized that information and education matter, but they are not enough on their own. Real improvements in health come from shaping environments, systems, and community conditions around us so that healthier choices become the easier choices and are accessible and achievable by all. She pioneered our community's first community health assessment and our community health improvement plan, engaging leaders across SLO County in using data and evidence-based strategies to make meaningful community-wide improvements in health and well-being. While some public health work is immediately evident, such as when an outbreak is halted, much of its impact is felt the decades after the work happens, such as when a child doesn't develop asthma or an older adult lives a healthy, active life without heart disease. Many of us will have access to greater health in the years to come and can live in a community that supports greater well-being for our children, thanks to her legacy. For these impacts and many more, thank you, Dr. Borenstein, for your service to our community.
Thank you.
Yes, of course we want to hear from you, Dr. Borenstein.
God, I'm a little nervous, and I always tell my staff who are giving their first presentation or 15th who are nervous, I said, you can never say that on a microphone. People won't know, and just do your thing. But anyway, so here I am. Hi. Is it 17 or 18 years? The media kept, going back and forth on that. 17 and 5/6. So if any of you want to do the math, I'm exactly 2 months shy of that, 18 years. And the media, however, have been my friends. I know a lot of people really shy away from that or don't want that or think they're going to be problematic. But really, I did 92 press conferences. I think someone counted during COVID, and we developed sincere relationships with the media and in public health. That is what you need, excuse me, to get the word out about what people might consider doing in terms of making their health better. Sorry. Pretty much everything I was going to say has been said, both in a way too long resolution and my two peers, colleagues, wonderful people. But of course, I want to say, well, there's a couple of things I want to say. Sorry, I know you have a long day. But the first thing was when I came to San Luis Obispo, drove across the country from Baltimore, and the GPS took us by Route 58. I'm not kidding. And when we drove through there and said, what have we done? Rural community, nary a house. And then we got to Slow and spent some time in Slow and spent more time in Slow and realized it has incredibly nice people, real beauty, a little kitschiness, and of course the wonderful weather. So no more ice scraping. So that's been a great thing. The other thing I certainly want to say is talk about my staff. And I know everyone says they have a wonderful staff, but ours is really remarkable. I don't know if you've worked with people certainly at the division manager level, but all through the ranks. We have an amazing staff. I did bring one piece of paper so I wouldn't forget anyone. I'm sure I have. And I'm not going to say names when I said forget anyone. I just want to go through the alphabet soup of our smart, competent, committed, giving staff and all the diverse categories that they represent. And I've often been heard saying public health is more diverse than any other department in the county. I believe that to be true. We're all over the place, whether it was in the Ebola full-born papper suit to doing home visiting in a at-risk mother's house to making sure the ambulance right on the street to et cetera, et cetera. I won't go through our whole department. But our team is consisting of all the A's, AAs, ACs, AOs, AMs, and then we have other admin staff now, IT staff and accountants, nurses, nutritionists, PTOTs, or is it the other way around? I see Frank, OTPTs, we never know. Occupational and physical therapists, for those of you who wanted to know, program managers, and the new HHPMs, Health and Human Services Program Managers, our public info team, HESs, EHSs, EMSs, and of course our labbies. And I don't mean canine Labradors, and also the PEP team. No, we don't have pom-poms and spirit wear, though that wouldn't be unusual despite 15 cracks at a dress code that everyone could live with. So at the end of the day, I just want to say thank you very much to my staff who, as I said, are incredible, but also I've had the opportunity to work across sectors in the county with the community at large, with schools, with hospitals, with CBOs and other county departments. It has been quite the ride, and I'm humbled and enriched by it. Thanks.
Well, we are honored to be able to recognize you today. Before we go to board member comments, I want to ask, are there any other members of the public that would like to comment on this item? I see we have Robert Reyes, our ACEO, and then Frank Warren. And if there are any other members, please do fill out a speaker slip and bring it to the front. Thank you. Mr. Reyes.
Robert Reyes with the Executive Office. Just want to congratulate Dr. Borenstein. Most notably, I just want to extend my appreciation in my previous life with the probation department. Her leadership and the strong partnership that we had at our juvenile hall with her public health nurses, their dedication and commitment, not just to the physical health of all the kids that are there, but really beyond that, just having a great interest at that they achieve things. We're there as mentors, sometimes as mothers and fathers. They did a lot more than just take care of the daily medical needs. So I want to just thank her for her leadership and collaboration, and thank you for this last 7 months. I've gotten to know Dr. Borenstein in a different way than I did when I was the probation chief. And so we've had a lot of great dialogue. And sometimes I gave her the thumbs up and sometimes the thumbs down, but always enjoyed the dialogue, always enjoyed her thoughts. And so I just want to wish her all the best on behalf of the executive office, just a happy retirement. So thank you.
Thank you so much. Frank Warren, Interim Behavioral Health Director. I had the, this is where the roast begins, just so you know. Just kidding. I had the great opportunity of getting asked to join the Emergency Operations Center sort of at the tail end of the vaccination movement in 2021. And I spent 5 months working for Dr. Borenstein. And more importantly, I had those 5 months, I was seated right next to her in the main control office. And I watched on the daily her come in and go through her voicemails, which at the time were the cruelest, ugliest, most hate-filled vitriol from a public that she was working so hard to protect. And I would listen, and let's go. We can't take. How do we take this? And she would just look at me and go, and say, "We got this." And I learned so much in that time about resilience, about true leadership, about mentorship, about patience, and then having a plan that you were going to stick to. And so I want to thank you for that. I learned so much in that time. And then I've had the last few months the opportunity to be your colleague and to truly get to walk alongside you as we've taken on this very difficult task of removing a banner of the health agency. And as we kind of acknowledge that today with the passing of the budget and some of the other things that are happening, this is a very significant day in many ways. And getting to work with you as your partner and getting the thumbs down with you and the thumbs up as well, you've taught me so much in that process as well about how to do it with dignity and humor and patience. And so I'll always be appreciative of that. It is a hoot to work with Penny Borenstein and all of these folks here who are the most loyal public health people you'll ever meet. And they are absolute products of that type of leadership. And I'm just proud to have been part of it too in this time. So just thank you for that.
Are there any other members of the public or staff that wish to speak on this item? Okay, seeing none, I'm going to close public comment, bring it back to the board for our comments. Supervisor Gibson.
Thank you, Mr. Chairman. Over recent weeks, I've put together what I wanted to say, and the words sort of fail me now, because the protection of the public's health is one of the most noble services that government, especially local government, can provide. And to see professionals so committed to it is truly inspiring. It's been an honor to watch you work, Doctor. You know, public health emerged as a discipline, 125 years ago at the turn of the 20th century or so. And I know it was a fight to get established, to take on diseases, but it was a fight that was held with facts and science, and it ultimately prevailed. And it prevailed so demonstrably that we sort of came to take it for granted, that the quality of life that we have here now as we exited the 20th century and started the 21st was just taken for granted. Fast forward then to 2019 and 2020 and comes COVID. And all hell breaks loose in a variety of ways. And what I remember of Dr. Borenstein, as that really the volume got cranked up to 11 on that problem. And I can't remember whether you said it explicitly or whether you just radiated it, that pandemic was the event that you had trained all your life for. And that in some strange sense, there was no place else you'd rather be than in the middle of fighting that pandemic on behalf of our county. And I always took that away as the ultimate expression of a public servant doing amazing things for their community. I thank you for it. As I say, it's an honor to have worked with you in a number of different roles, and I wish you the very best in your next phase.
Supervisor Ortiz-Lake.
Yeah, well, you packed the house, and we knew that was going to be the case. And I think that we want to say thank you. As Supervisor Gibson, I'm surprised he didn't shed a tear because I heard it coming. But as he really stated very well, how much you've helped us get through so many serious situations and help prepared us for the future. And you noted in your comments your staff. And I want to say that we have noted that your leadership team is incredible and that the expanse of services and ways that you provide that education and public health information to the community. I just want to say thank you, particularly for the Healthy Voices, multilingual system to be able to help people understand what's happening and to educate them. That is just really huge. The maternal and child health prevention that we do, we sit together on First Five, and your dedication to be on that board and to continue looking for the little ones 5 and under and all children and mothers, from car seats to oral health, to tobacco and cannabis information, to nutrition, simple things such as nutrition, which isn't so simple in today's world. So just it's the breadth and width of everything, Dr. Borenstein, that we're so grateful for your input and your guidance and your leadership. And we just wish you the best in your retirement. And we know that you got a lot of good things to be coming forward. So, but thank you for serving us.
Supervisor Pichon.
I want to thank you for your calm and steady leadership, having been through the COVID and the whole thing, in 92 press conferences that you had. And I got to participate in some of them, being on the board, and I was the board chair at one point. But what a roller coaster ride. It's incredible. But I will tell you that your steady, calm leadership really did shine through during the darkest times this county has seen in a long time, and appreciate all you did. And all the people that you gave great advice to, me included, as we went through that. So thank you for your efforts. I wish you all the best in your retirement. And I will say it again, I've never met anybody this calm and this steady from back east.
Supervisor Moreno.
Yes, it's certainly the end of an era, Penny. I particularly appreciated during COVID, I was the mayor of Atascadero, and you held, I think it was 3 times a week, meetings with all of us on the phone. I think the chair of the board was on the phone, and you were very communicative, answering all the questions and really keeping us informed, and that was so important during that time. So thank you for your leadership, and I wish you just a great next phase.
And I'll echo those comments. But first, I want to just issue an apology. During COVID, there was actually money for public health. Right, we had the American Rescue Plan Act. There was funding for your department. And you were tackling the challenges of the day. Post-COVID, a lot of those limited term positions that were funded with those funding sources had to be clawed back or not fully funded, and so the board that I inherited and the opportunities I inherited actually came with a lot of need to cut back, and that's been a challenge for all of our departments, behavioral health, public health in particular. And so I apologize on behalf of the board for having to go through that, but you really stepped up just like you have historically when the moment needed leadership, and we really, really appreciate you navigating those challenges, leading your department, leaving us in really good hands. We know that you're leaving a wonderful legacy and really competent public health department staff to continue to help meet the moment in the future. So I will also echo Supervisor Moreno's comment. I was on the Rio Grande City Council while going through the pandemic, and your leadership was so critical to the region because anybody in a leadership role was dealing with people that were really, really afraid, and having a calm, consistent presence and constant communication was really the way to navigate that. So thank you so much for your contribution to this county, to our organization, and we wish you the best in retirement. Thank you, Penny.